Hi, and welcome to another episode. I'm Christine, your host. And today we are going to be talking about what I wish that all parents knew about feeding therapy. I feel like parents really come into feeding therapy not really knowing or understanding what it's supposed to look like. How do you know anything before you try it, right? Like you probably, didn't know what parenting was really going to be like until you were a parent, right? So, but this is, I wish if there was like, I don't know, or a pediatrician that was explaining feeding therapy or something to parents like that. This is like what they would explain, right? So this is like my ideal. So hopefully you'll get a lot out of this. But you might not realize that there's, oops, sorry, I'm just going to put this on focus. I guess it wasn't. A lot of parents, they go into any sort of therapy thinking that the therapist is, the expert and they absolutely are going to know everything about how to fix this particular problem with your child. And a lot of times, actually, that's just not true. Not every therapist knows everything about every topic, right? That's why it's good to find somebody who specializes in feeding specifically, because, and I've said this, in other episodes as well, but there's no like standard training. So feeding therapy doesn't have its own degree. They tend to be speech pathologists. They tend to be occupational therapists. However, there are ABA therapists doing feeding therapy, which is a topic for another day, but I never agree that an ABA therapist should be doing anything relating to feeding. I feel like it's like one day perhaps that will be considered like malpractice or something, but it is not currently. But anyways, again, topic for a different day. But here's some, let me just dive into some of the important things that I wish everybody knew. But that first one, not everyone is a feeding therapist. Not every therapist who's a speech therapist or an occupational therapist is versed in feeding, enjoys feeding, knows anything about feeding. Because I'll tell you, in school, typically the class on feeding is actually called dysphagia. And the dysphagia class is actually about difficulty swallowing, which is different from our severe picky eaters. Like none of those skills really transfer at all. So that essentially means most therapists come out of their grad school with zero experience in how to treat kids who are very fearful and selective about their eating. They don't know why it's happening. So they're only going to be able to use the tools in their toolbox that they have, right? And for a very long time, that was me. So I know that that is the case. But that's a super important thing I wish parents knew, is that, you really have to find someone who specializes in the specific area that you want to be improving upon. Just getting someone who's good at everything is usually doesn't lead to the best outcomes. Or, I'm not saying that you're not going to make any progress, but it might be very slow, or it might not be the kind of progress you were hoping for, or the kind of changes you were looking to see. The other thing that parents think, it's just about eating, right? Feeding is just about getting them to try new foods. And that's what we're in feeding therapy for. And anything else is a waste of time, right? But feeding is a whole body experience. And it is a process. It is not just about trying new foods, right? Eating requires coordination of your sensory system, your motor system, your emotional regulation, and your psychological systems. It's a lot of interplaying systems that need to work and jive together for eating to be considered a success, for you to be considered a good eater, quote unquote, right? So a lot of times parents just don't even know or see those underlying skill deficits that still need support, right? Like your posture, where you're eating, your environment, your oral motor coordination, other issues like tongue ties or lip ties that can also impact. So it's, I guess, a good summary of that is it's more involved than most parents believe it is when they are starting out in this journey. Or even sometimes, honestly, they might be 1 or 2 years into it and still not really knowing why their kid is not making progress. They've been in therapy, they're not making progress, but they've never been taught anything about, oh, it's actually like a whole bunch of things that need to be addressed. And they're only working on this one little tiny piece of it, right? Maybe that's why. The second, or I should say the third thing is, I wish parents knew that this was not a quick fix, and you can't just give a reward to get this to go away, right? It requires the kids to have trust. So that comes to an emotional level, and trust is going to take time. Now, also, the longer that this has been an issue, the longer it will take to fix, because trust takes time to build. And if you've had repeated experiences where kids feel like they can't trust the food, they can't trust who's giving the food to them, not to trick them, or something like that, it's going to take time to undo some of those things, right? This is why I said that I don't think ABA therapists should be allowed to do anything relating to feeding, because behavior-based approaches can often backfire with kids who are very fearful, because it becomes a compliance thing. You take this bite, you get this thing. You take this lick, you get this thing. And kids could be compliant up to a point, but that doesn't mean that they're going to learn to love food. It doesn't mean that they're going to, be able to handle more complex textures confidently. I feel like I wish parents knew that not just that trust takes time, but we want kids to be internally motivated. We want them to be like, ooh, that looks good. Ooh, I'm hungry, right? We don't want them to be like, yes, mother, it's time for me to eat again. I will have the 3 bites of each thing. Like, that's very, I don't know. That's just very disconnected to me. That doesn't seem happy. It doesn't seem like anyone would enjoy that kind of a meal. So we want kids to be intrinsically or internally motivated to take the next step with food, right? And because this all takes time, right, your role as the parent actually is going to play a big role in this, right? So we're going to get into that in a moment. Another thing I would like you to know is that kids are usually not just being difficult. They're not just oppositional. Of course, that can play a role in it, but in almost all of the cases I have seen, it's not just that they're trying to be difficult on purpose. It's usually nervous system dysregulation, sensory overwhelm, and those can present as oppositional behaviors when it comes to food, when it comes to listening to you. Right. But when we understand the why, when we get to the root causes, a lot of times we see kids start to decrease some of those behaviors naturally, because we fix the underlying issues, not because we've scared them into compliance. Like, if you don't do this, then your dad's going to come home and hit you or something. Like, it's not about that. We are able to shift their behaviors usually by doing things like calming the nervous system, giving them good oral motor skills and tools to help them work through hard situations, giving them the trust that we are here for them and we're not giving up on them and we're going to support them. So, it is usually more than just, oh, they're just being difficult about eating, right? And I have heard that many times, but a lot of times I wish parents knew that's probably not it. Um, and I wish all parents knew that one of the most important shifts that they can make is shifting from the mindset of, how do I get them to eat that thing on the plate that I just made, to what do they need to feel safe enough to try this new food? That is a huge change in perspective. It's and it shifting perspectives in that way can be incredibly impactful for the types of progress you will see that follows that mindset. So that's why we always teach parent mindset when it comes to feeding, because it's very, very, very important for the parents to have some of those mindset shifts as well, because usually your mindset needs to shift first before theirs is going to shift. Okay. And this brings me to my next point. I wish parents knew that feeding therapy needs to involve you as the parent, not just your child. And this is why I often talk about why drop-off therapy is not very effective, right? I'm not saying it's completely ineffective or you'll never see progress with it, but in my experience, if you are not a part of the therapy process, how are you going to know what to say, do, change at home to see these shifts? Like, if all you do is send them into the room and they come back out 20 minutes later with a sticker, and I do mean 20 minutes. We have many parents that come to us after failed therapy saying, well, yeah, they had 20-minute therapy sessions. I was like, oh goodness, that's very, very short. I can't imagine what you're getting done in 20 minutes. But what did the therapist explain to you what they did? Did they learn anything? What should you be working on? Why are you working on that skill right now? What is your goal? What have you tried? What didn't go well? It has to involve you. Okay. You are with them the most, you know them the best. I mean, I hope that is true, that you're with them the most and you know them the best. But we need to help shift your mindset. We need to work on your home environment. We need to work on the language that you're using around them and with foods, and the types of activities that you do, and how much when to push and when to pull back. You're co-regulating them at meal times. So you're not just putting the food down and observing them and walking away. You're a very important part. And I wish that all parents knew that, because I feel like even some parents that come to us, even though we explain this to them, when they actually get into it, they realize, oh, actually, they want me to do stuff. Like, oh, I have to be involved now. Like, I still feel like sometimes there's like almost this disbelief that we just like we're talking about it when we introduced you to our program. But yeah, sometimes I feel like it takes parents a while to be like, oh, okay, this isn't gonna change until I change something. And that is usually the case. And all of our parents that do our program and the ones that do our coaching program, I always say they make bigger gains than the parents that come to us weekly for one-on-one therapy, which is more expensive and more time consuming than our virtual coaching of parents, because they are totally engaged, totally immersed in what they need to be doing and carrying it out every day. So they make actually faster progress than some of our in-person clients for that reason. So yes, the more you that is involved in therapy, the faster the progress that will be made, right? It is not just about showing up, dropping your kid off for therapy. That is a huge thing. I wish parents knew that. And I do wish that parents knew that feeding therapy should be holistic. It's been my worldview, I suppose you can say, for, oh goodness, the better part of 10 to 15 years now that the holistic way of healing is really the only way. I know Western medicine likes to categorize things into like little pockets, but very much like you can't totally separate out, you might go see a cardiologist for a heart issue, but the heart is intertwined with the respiratory system. And, everything is very intertwined in your body. It's very hard to tease things out. And very much like that, we take a holistic approach to feeding. We talk all the time about the 4 pillars of feeding, which is your gut, your sensory system, your oral motor skills, and your mindset. And all of those play very key roles with one another to make feeding a success. Okay. So, if your gut is off, you're not going to have a successful eater. If they have poor oral motor skills, they're probably not going to be a successful eater. You can't just address one of those pieces. You have to kind of address all of them. Not necessarily all at once or all on the same day, but you have to know where they're having issues across those domains, because it's like you just can't like do one without the other and expect to see progress. That's why the behavioral therapists, like ABA therapists, they're trained in behavior. They're not trained in sensory systems, oral motor systems, definitely not trained in more like co-regulatory mindset types of things. They're more like, you jumped up and down, you did what I asked, here's your M&M. Like that is generally speaking. And I don't want to speak for all ABA therapists. I mean, there are definitely some that are better at generalizing things than others, but it's based on, you showed me this behavior and this is your outcome. This is the consequence. This is what you either get or is taken away because of the behavior that you have shown. But they're not doing underlying things. They're certainly not asking about their gut, bowel movements, constipation, reflux history. We need to know these things. It should be holistic, because when you address the whole system, then everything starts to improve. But when you leave out one of those puzzle pieces, you might see a little boost in progress and it either might stop or progress a little bit. It's hard to progress to the place of foodie when you don't address all of these things, right? So we like to collaborate. We refer out when we need to, because it is a whole body. You eat with your whole body. It's not just your mouth and your eyes and your stomach. Your whole body is involved in eating. Okay. And I mean, I guess the elephant in the room here would be, most traditional insurance-based feeding therapy doesn't include what is needed for lasting progress. It's not a full body approach. It's not root cause approach. There's not that integration of the gut, the oral motor, the sensory, and the mindset together. There's not parent coaching. Sometimes you're not even present or allowed to be present in the room. It's more like they're checking boxes. They touch the food, check. Let's move on to the next skill. It's not true intentional progress, right? Sometimes, like I said, you can see a little bit of progress there. It might take a very long time to progress through those check boxes. But, I just to give you like a little quick aside, we had a parent recently who called, and they had been in feeding therapy for years, she said. And she said that they spent 11 weeks licking a Cheerio, trying to get to that next checkbox. And I was like, that is not what feeding therapy should look like. That is behavior-based, and it's probably not at all what this kid needs to move forward. But why does this happen? Like, why, if you take your child for feeding therapy, are they not doing those things? Why is it not looking at everything. I mean, unfortunately, it's insurance. Insurance dictates what gets covered. They don't pay for sessions that are long. Okay. I can get into more nitty gritty, but I will tell you that it's one code that gets billed. That's the technicality of it. And they don't care how long you see that child. If it's 5 minutes, 30 minutes, 60 minutes, right? So they're giving the reimbursement for the clinics is not a very high rate at all. It's barely enough to cover the therapist, and it's really not even what the therapist should be getting, right? And to give the agency or the clinic maybe, a small cut of that, but it's just not enough time to dive deep. It's not enough time. And there's just the incentive isn't there maybe to learn above and beyond. I mean, it just stinks. And I don't know if insurance is 100% to blame. I mean, there are absolutely some amazing therapists, I'm sure, that take insurance that are really knowledgeable. And, they take insurance, but there's still going to be a constraint on how much they could do because they are limited by insurance. Like you can't do, you can't see them like sometimes more than a certain number of times a week, or you might get like allotted like 30 sessions or 25 sessions. And if they're contracted with insurance, you can't say, okay, well, after your, whatever therapy, or if you want to extend your therapy, I'll just charge you extra and we could stay a full hour. That's illegal. That they are not allowed to do that. So there's just a lot of handcuffs on what clinics can do who take insurance, unfortunately, which is why we don't take insurance. That is literally the exact reason why we don't. I mean, yes, they don't have good reimbursement rates anyway, and they're difficult to deal with. But still, we can't do the therapy the way we like to with them telling us what to do, because then we work for the insurance company and we don't work for you. We want to work for you. We want to be the best possible support that you can have. And we don't want anyone telling us how long we can treat or not, or how many sessions we're allowed to give. To me, that seems completely insane. So I get why some people, of course, need to go that route. Private pay is not the route for everybody, but I just wanted you to understand the why this happens, why these clinics all seem to be sort of similar in how they approach it when they take insurance. It's just, they're very tied. They're very tied. And it's not fair. It's not fair to them. It's not fair to you. It's not fair to the therapist. It's just not fair to anybody. The only person who wins is the insurance company, who collects your money from your paycheck every month and then gives you the output is, essentially crap, right? So it just stinks, right? So a lot of times they try to have bigger caseloads because they need to make up for that lack of pay that they're getting from the insurance company. So they have to see more people. So when you have to see more people, then you can focus less on each one, right? That's just what happens. So it's not sometimes that the therapist doesn't care. It's usually that the system is broken and it's not allowing them to do their job the way they should. And also that system, that same sort of broken system, didn't teach them everything they needed to know. And you don't know what you don't know. Right? So just like I wish you knew these things, I should do an episode of what I wish every feeding therapist knew. I mean, I wish they knew all of these things as well. So if you're wondering, that is what goes on. That's like the discrepancy. So I just wanted to do like a little bonus, some red flags that your child might be heading in the wrong direction when it comes to feeding or feeding therapy, right? So if sessions are drop off only and there's no parents allowed in the room, there's no involvement, of you at all, that's a red flag that therapy probably isn't the best fit for your child. If the therapist is not asking about things like gut issues, early feeding history, sensory sensitivities, even at a cursory level, if there's no mention of those things, probably a red flag that they are not a specialist in this particular area. If you're told to wait it out, or they'll grow out of it, or, just expose them to foods at home and they'll probably be fine, that therapist probably doesn't have the proper training to fully assess your child's needs. If it's only focused on behaviors, not skills, not safety, not mindset, just their behavior, right? So the behavior is touching it, licking it, smelling it, tasting it, taking a bite. Like, that is the behavioral outcome. But if you're not focusing on any other skills deficit areas, then that might not be a good fit, especially if in doing that, you are not seeing any good progress, or if you see your child actually start to go backwards because they truly don't they're just being pushed too hard. Also, if you see your child leaving therapy more anxious or shut down than before, or they just complain like, "Oh, I hate going to therapy. She makes me do something that I don't want to do." Right. So if any of those are happening, I'd say those are red flags that you might be heading in the wrong direction with feeding therapy. So, and if you have experienced any of those, it does not mean that you have failed. It just means you might be with the wrong type of support for what they need right now. Right. So we want to know, where is your child? Where are they stuck? If you take our quiz at the pickyeaterstest.com, you will get your child's eating level, right? So this is very important because we don't want to give you tips, skills, advice, direction on which way to go if we don't know how severe the issue is, because at different levels, your child is going to respond to different approaches very differently, right? So, for example, just doing exposure is never going to work with a child who's just in the fearful stage. I mean, most of the time, it actually will make things worse depending on how fearful they are, honestly. Like, I had a parent once who said, "Oh, I tried to go to feeding therapy once before, but the therapist said to just expose them to new foods. But when I did that, he had meltdowns, and then he didn't even want to eat at the kitchen table anymore because of the food exposure I was doing. So I don't know if I was doing it wrong." And I was like, I think it was just the wrong level. Like, that wasn't the skill he needed to work on. Like, that was a later skill. So the order you work on things is very important, right? So this is why taking our quiz, you can find out what the level is, which will then trigger, it'll say like what's the next recommended step that makes the most sense for your child's level, right? And, I just want you to know, I guess the bottom line is what I wish parents knew is it's more than just being about food, right? And if you feel ever that there's just something more, there's something you're missing, there's something deeper, you're probably right. You got to trust your mom gut, you got to trust your dad gut. I would love to welcome you into our program. If you feel like it's aligned with what your needs are. But there's so many ways that we can help with our resources, other podcast episodes. But if you do want to take a lot of the guesswork out, I do suggest our amazing transformational program, Unlocking Meal Times, as I usually do. It's something I'm so super proud of. And we've worked so hard to now refine and create such a positive experience for all of our clients, so that they can see lots of success. And I'm just so proud of all of the success that our clients have made. And when I say our clients, I really do mean our parents and our kids, because our parents work so hard as well. And it's really their dedication to making these changes that is so inspiring and so amazing. And yeah, I'm just always in awe of them. So we do hope that you join us. If not, we'll see you next week. All right. I hope you guys have a great week, and we'll see you soon.
Thank you for listening to How to Unpicky Your Picky Eater. To learn more about achieving your child's feeding goals, check out Christine's website at foodologyfeeding.com. And be sure to tune in next time to How to Unpicky Your Picky Eater.